Hello, we are group 6. Our group members are Zinah, Fjona, Lucas, Jacob, Michelle, Qamar, and Sara. Our study is the comparison of BioWaveGo versus iReliev pain management system for the control of arthritis-related pain. Clinic to improve quality of life in patients with arthritis. Arthritis is a chronic condition that affects more than 29 million people in the United States. It is a condition in which many non-pharmacologic agents are needed to address the pain and mobility issues that arise from this condition. One objective of our clinic is to improve quality of life scores as assessed with the rapid 3 questionnaire through patient education on arthritis self-management and healthy lifestyle interventions. This would include our recommendations on different non-pharmacological therapies, such as TNS devices. We would consider patient needs, cost effectiveness, and the clinical evidence in making these recommendations.
The iReliev pain system is composed of the transcutaneous electrical nerve stimulation known as TENS. TENS uses electrode pads as conductors on the skin to transmit soft electrical impulses, and these electrical impulses then stimulate the nerve endings. It works by releasing subtle electrical impulses that intercept the pain signal from the brain. Therefore, they eliminate the feeling of pain while you use the system because it stimulates the release of endorphins. There is 8 preset treatments on the device and 25 levels of intensity and portable size. It helps with chronic pain, acute pain, and arthritis. Arthritis specifically, Program 8 is designed to help the patient overcome pain that's associated with arthritis. And then it includes the TENS device, 3 AAA batteries, 2 lead wires, a belt clip holster, a tote bag, and 4 2x2 electrode pads in the device. And it's a drug-free treatment with minimal side effects that will most likely help the patient.
Now we're going to talk about the BioWave system. The BioWave system introduces 2 sound alternative current high-frequency sine waves into the body through a first disposable non-invasive round electrodes, 2 inches in diameter, placed on the skin directly over the pain site. There is advantages and disadvantages for BioWave. The advantages for BioWave technology is being explored as a novel therapy for treating chronic acute or post-surgical pain in the low back, shoulder, neck, hip, knee, elbow, face, legs, arms, wrist, hands, ankles, and feet. The disadvantages of BioWave: the patients complained that they could not increase the signal intensity to a high enough level for the pain site electrodes on the back because the stimulation sensation felt on the abdomen preventing them from going higher. Thanks.
Manufacturer claims regarding the iReliev pain management system include that it is FDA cleared and tested to be a safe and effective pain relief solution. There's no pills involved. It's all natural and drug-free. No prescriptions, no trips to the pharmacy for a refill. Prescription strength without the cost. Medical grade prescription strength relief without having to pay astronomical prices. The device has 8 programs for acute pain. It is great for slight pain that comes and goes. For arthritis, Program 8 is specifically designed to help you overcome pain associated with arthritis. For chronic pain, perfect for more intense pain that is long-lasting. Also, the backlit display increases the ease of use. So you should have no trouble choosing the setting that works best for you, no matter if it's day or night. Regarding the BioWaveGo, manufacturer claims include that it is easy to use, no programming is involved, that it has strong pain relief and higher electrical output than the TENS systems, more comfortable on your skin because of its sinusoidal waveform. It goes deep, so the high frequency penetrates deep tissue, better efficacy with frequency conduction block, and leading edge technology with the accompanying app providing treatment data that can be given to the provider. Additional manufacturer claims by the iReliev pain management system include fewer hospital and physical therapy visits and required less surgery, reduces pain and improves range of motion in chronic back pain patients. Additional claims from the BioWaveGo system include that it delivers better pain relief outcomes, with 94% of patients reporting an improvement in quality of life after 2 weeks. 59% of patients reduced or eliminated their pain med consumption after 2 weeks, and an average of 8.02 hours of pain relief.
We evaluated the BioWave in-house study non-invasive targeted electronic pain control device BioWave system versus transcutaneous electrical nerve stimulation for the symptomatic treatment of chronic low back pain. The study included 18 patients that were randomly assigned to the first group, 9 starting in TENS and 9 starting in BioWave. The crossover occurred halfway through the treatments with a 1-week washout period. Those included in the study were patients with a baseline pain measurement of 40 or higher on the visual analog scale that was 100 in length. The primary outcomes were to compare the mean of the visual analog scale of both deep and superficial pain between the devices, as well as to determine the duration of pain reduction between the devices. They did this by taking the VAS at various time intervals following treatment. For results, deep pain for BioWave VAS pain scores averaged a 75.3% reduction in pain at 1 hour post-treatment and 53.4% in 24 hours post-treatment, whereas TENS saw lower percentage reductions with a 62.7% at 1 hour and 36.8% at 24 hours. Surface pain had similar results between the devices. There was a greater reduction in percentage of VAS in the BioWave compared to the TENS at all time intervals. For both types of pain, BioWave showed a higher percentage of pain reduction for a longer duration as seen on the graphs here. There was additionally no concern for adverse events among either device. The investigators defined a significant drop in percentage of the VAS score to be 30%, and this was based upon what pain healthcare providers believe is an adequate reduction. There was no placebo included in the study, but investigators believed this was more than accounted for in the 30% reduction. Because of this determination, BioWave was shown to have significant reduction in pain compared to TENS. In evaluating the study, our group contributed many of these positive BioWave results to confirmation bias due to the involvement of the BioWave Corporation. Deep pain and surface pain were not clearly defined, and patients often were not able to distinguish between the two as well. There was no placebo comparison or strong statistical analysis using p-values between the arms, but rather defined by what the investigators believed was adequate. Therefore, our group would not be able to make a strong recommendation for BioWave over the TENS devices based on this study alone.
All right, so on to our second study, which is the effects of transcutaneous electrical nerve stimulation on pain, pain sensitivity, and function in people with knee osteoarthritis. This was a randomized controlled trial. It included 75 total participants, 29 of which were men and 46 were women. They were between the age of 31 and 91 years of age, and they all had knee osteoarthritis. So of these 75, 25 were assigned to high-frequency TENS, which is 100 hertz. The second group was 25 as well. They were assigned to low frequency, which is 4 hertz, and then 25 were the placebo group. So the inclusion criteria was as follows. They had to have a diagnosis of medial compartmental knee osteoarthritis. They had to be 18 to 95 years old, able to ambulate to mailbox and back, a stable medication schedule for 3 weeks before testing, and a pain scale and a pain rating scale greater than 3 out of 10 during weight bearing. The exclusion criteria was uncontrolled diabetes or hypertension, dementia or other cognitive impairment, neurological disorder, permanent lower extremity loss, earlier TENS use, knee surgery in the last 6 months, or a knee injection in the last 4 weeks. So the primary outcomes, we have PPT, which is pain pressure threshold, and also pain at rest. These were both measured during the study. So for the results, the PPT was significantly increased in the high frequency and low frequency TENS groups with a p-value of 0.002, while the placebo group failed to demonstrate any significant change. Pain at rest scores for all three groups were significantly decreased. So p-values were as follows. We have 0.001, 0.01, and 0.0001 for high frequency, low frequency, and then placebo, respectively. It was interesting because obviously the placebo had the highest effect on pain at rest scores, which is interesting. Applications of this study. So it's applicable to patients experiencing primary and secondary hyperalgesia, which were, based on the objective PPT scores, in patients with medial compartmental OA. High frequency and low frequency TENS are both effective for reducing primary hyperalgesia, while only the high frequency one was effective in reducing secondary hyperalgesia. On to the quality of evidence. So evidence is strong that the pressure pain threshold can be reduced by a TENS system, but the resting pain and the tug test that were completed in the study were all comparable to that of the placebo, which kind of makes it insignificant for those specific objectives. The study is also limited in its number of participants. 75 isn't a great number to evaluate these kinds of things. And then also by the fact the study really only applies to acute use of TENS and not chronic. They only did one session of TENS, so it doesn't really evaluate that if you're using it every day. In summary, TENS needs to be more extensively researched in different application sites, not just the knee, and also the various forms of arthritis pain.
So now it's time for the takeaway points of our presentation and our clinical recommendations, both as they pertain to our ambulatory care clinic as well as patients as a whole. So when you're talking about medical technologies and making recommendations to patients, one of the first things you should take into account is the cost. Oftentimes, these technologies will not be covered by insurance, and patients will be taking the costs completely out of pocket. So it becomes immediately obvious when you're looking at the two that a BioWave is much more expensive. The starting point for BioWave is $400. In comparison, the iReliev units, which are TENS therapy units, start at $70, with the premium ones going up to $150. Both technologies operate on very similar principles, that being electromagnetic stimulation of soft tissue. The difference is that the BioWave units use 2 electrodes, while most traditional TENS therapies use 1. However, the frequency produced by the 2 electrodes producing wave interference is essentially the same frequency that the TENS units was producing on its own. So fundamentally, they are versions of the same technology. Now, the evidence for TENS has been around for much longer, and it's much more well established in comparison to BioWave. The state of the evidence for TENS suggests that it's a useful form of therapy for many types of musculoskeletal pain, including arthritis and a variety of joints. Now, BioWave's dual electrode technology is proprietary, which limits the amount of research that can be done on it at the moment. All the research that we have available has been funded by the BioWave company. In theory, it makes sense to speculate that the dual electrode interference pattern could have greater effects and greater tissue penetration, but because it's experimental and proprietary, it would not be ethical for us to recommend it to all patients, universally, or to even recommend it over TENS therapy to most patients. Patients who could be recommended a BioWave would have to have already tried TENS therapy and would also need to be able to afford it without any significant financial distress. However, in the future, with more research on this technology could be very promising. It has a lot of theoretical promise for helping patients with their arthritis pain. Now, as for whether or not we can recommend TENS therapy on its own, we believe that the state of the evidence is strong enough to say that TENS therapy is something worth trying for any arthritis patient with at least mild arthritis pain whose baseline pain at rest affects their quality of life. And we think that TENS therapy is a good choice for these patients because it's both affordable and non-invasive. For the same reason that we recommend that patients try it, we also think that it would be very simple and seamless to incorporate into our ambulatory care clinic, as it is relatively cheap, it has immediate effects within minutes upon its use, and it's completely non-invasive. It just involves putting a pad on someone's skin. So, with that being said, thank you for watching our presentation.